welcome back to the broadcast. Well, you know that I love when Health Diagnostic Laboratories is here. Everything that they talk about, everything they share with us, I think is such an eye-opener as it comes to our personal health. Well, we did our blood work not too long ago, so Dr. Dahl is here to share with me some of the details of this blood screening and what it means. And let me tell you, this is a report, this is 11 pages long of details, all sorts of details about your blood and what it says about your health, and then things that you can do to get better. So one of the things that you test for is inflammation.
Right.
What does that mean? Because I thought, you know, I have a bad back, maybe there's inflammation in my system because my body's like trying to, you know, deal with a pain or something.
Right.
But
so there's different kinds of inflammation. I mean, there's inflammation that happens acutely because we've injured ourselves, or maybe we have a cold or an infection or, you know, pneumonia, and that's all going to create an inflammatory response in our body. And that's you know, a normal response to an insult. But we also can have inflammation occurring at the walls of our arteries and our blood vessels. And if you think about a blood vessel becoming inflamed and angry, you get this big, hot, angry blood vessel, it's much more prone to injury, and these particles can get in there and begin to form more plaque, which can ultimately lead to heart disease and stroke. And actually, we really believe, after a lot of science suggests, that inflammation is a key driver of heart disease. And actually, just knowing, you know, someone's cholesterol measurement really doesn't tell you whether they're at risk, but understanding if they have these chronic levels of inflammation can really make a difference. So at HDL, what we do with our laboratory analysis looking at inflammation is we look at 4 different types of inflammation. We look at the type that causes that acute response to infection, C-reactive protein and fibrinogen. So it's possible if you have arthritis or you have something going on acutely that could be elevated.
that's the CRP test that you would normally get at your doctor's office.
Right. The HSCRP. And then we'll also look at inflammatory markers that are more specific to the walls of your arteries. So we look at a test called LPPLA2, or the lipoprotein-associated phospholipase A2 test.
You're such a doctor.
So, I know, it's not really very layperson friendly, but that's the name of the test. And what that does is it'll look at inflammation happening at the wall of blood vessels. And if that's happening, we need to address that, because that means for whatever reason, your arteries are angry. If you have elevated particles that we detect on other parts of our test report that show that you have risk for heart disease based on these elevations, and you also have inflammation, that's kind of a double hit, and then we really need to be more aggressive at doing something to address that. So we might want to try to do things with our diet that are going to be more anti-inflammatory. We may want to use aspirin or fish oil or other things to help, you know, help with inflammation. Exercise is awesome at reducing inflammation. You know, eating well, you know, makes a big difference too. So it's a
like
really
all the
important
stuff
piece
that we already know. You know, eat correctly, exercise, everything in moderation. What do you think it is about us that we just can't seem to get it?
I don't know. We're busy. We're constantly sitting here with high levels of cortisol and stress, and that accelerates inflammation and insulin resistance. And I think we have to find a way to live a little bit simpler. I think that's, you know, a big issue. We eat a lot of processed foods because it's easy, and our lives are quick and fast, and I think that all contributes. You know,
but we pay the price for sure. So a test like this, and I can only imagine as a physician, you know, when you were trained like the other physicians that go through medical school, you were trained on the basic tests. So what was it about this that got you so passionate about being able to offer this level of testing and screening to people?
Right. Well, I actually, believe it or not, I've been doing this type of testing for 15 years. So I was kind of one of the people that was early in the game doing it. And I left medical school having been exposed to some advanced testing, realizing that there are a lot of people in this world that are having heart attacks, that have normal cholesterol, that have normal blood pressure, that nothing we are doing to screen them would have picked up on that. And I was watching people, even in my own practice, die of heart attacks that shouldn't have died of a heart attack. They're in their 50s, or they're even younger than that. And I wanted to understand, how can we do a better job addressing this? How can we find out what's driving these diseases that are killing us? The #1 cause of death is heart disease. How can we address them? Well, if we dig deeper, if we begin to look at these labs that give us a window into disease that's so much more accurate and can be detected so much earlier, that's really what's going to change the world. That's how we're going to beat heart disease and diabetes, is we're going to tackle this, we're going to take it on. So I made it my mission 15 years ago to start doing this. I've been using this type of testing in my patients for the last 15 years. I've been lecturing on it for a decade because I really believe in educating doctors about the importance of this type of testing. And I don't think think we do enough. And unfortunately today, what's happening is because of costs, cutting and everything else, insurance companies who used to always pay for this testing, at least for the last 10 years, are starting to not want to cover it anymore and not want to offer it to people. And I think that's a tragedy in itself. I mean, this will prevent a heart attack. This will prevent a need for a stent. This will prevent diabetes.
Yeah.
I mean, talk about cost savings, quality of life savings.
Right. It is one of the things that you all do, though, at Health Diagnostic Laboratories, is you work real closely with your patients with their insurance.
Right.
And this is a very affordable, I'll say absolutely necessary sort of testing for that early detection, which is able to save so many lives. And we can make easy changes based on these results.
Absolutely. I mean, everybody deserves at least one HDL panel.
Yeah.
So then you know, and you can be empowered to do something.
I feel empowered. I feel empowered with my 11-page report, which, by the way, another thing you guys do is you've got these wonderful consultants that can sit down with me and kind of go through everything if I have questions. So you really have a comprehensive understanding of your own health, which is so important. So thanks for being here.
Oh, thank you so much for having me.
You can talk to your doctor if you're interested in getting the HDL test. The HDL team is here with us every Tuesday, by the way, to talk about your health and talk about your results. Maybe you can go get the test and then bring your results home, and every Tuesday watch and sort of see what the information means for you. You can get more information about the Health Diagnostic Laboratory by going to their website there on your screen, or calling any one of those numbers. And of course, you can always find information on our website at thebroadcasttv.com. We have more broadcasts when we come back. Stay with us.